So now we know why we shouldn't use a tourniquet. And in fact, think back to the instruction about the mastectomy, lymphadenectomy patient. What did they tell you about the arm? No BPs, no IVs, and no blood draws. Now you know why. It was the tool that was the problem. The tourniquet and the blood pressure cuff cause an increase in the venous blood pressure, which causes leakage, extravasation, infiltration, the lymphedema. Well, for those patients, they can't get rid of the lymphedema, the swelling, because they have no lymph nodes. But it's also a problem we now know just for all patients, for IVs and for blood draws because of hemoconcentration, infiltration that leads to hemoconcentration. So now that we know we can't use a tourniquet, how are we going to locate that vein? And vein access technologies, where tools, technique, and science meet, developed a new palpation technique for locating veins, and not just any vein. We want a healthy vein, one that's going to tolerate the needle stick and the procedure. No rupture upon venipuncture. That's what we're looking for. That's what we're trying to achieve. And this new palpation technique does that. And to further emphasize that, there are many problems with the current methods for performing venipuncture. So take a look at this list on your own, because you'll look at it and you go, yeah, I remember seeing those injuries. I remember having those problems. And the consequences, adversely affects medical outcome. It increases cost. It's uncomfortable for the patient. It's very distressful for the worker. So we want to change all of that, and we will. Just know that this is very important because IVs, blood draws, and injections of contrast, not to mention all the other venipuncture procedures, these three are the foundation of diagnosis and treatment in the practice of medicine. Every patient gets a blood draw on admission, sometimes some daily during the length of stay. 7 out of 10 get an IV, and 5 out of 10 get an injection of contrast. So these venipuncture procedures are the most frequently performed procedures in the practice of medicine. And because of all those CCIFs, they are the most costly services to render in the practice of medicine. So there is a solution, a STEM solution, a science, technology, engineering, and math solution. And it involves the veniCuff and the 21st century vein access technique for locating, dilating, grading, and accessing veins for all venipuncture. And we're going to introduce the veniCuff and the 21 CVA in the next series, the next parts of this series that we're going to be recording shortly. So continue to follow the series. The veniCuff inflates to 20, maintaining normal venous blood pressure, not exceeding it, and therefore maintaining the integrity of the vein wall. And the new palpation technique works 100% of the time. You'll know where the vein is at. You're going to know if it's a healthy vein or not. And then we've also developed a new needle insertion technique for preventing vein wall injury, vein rupture, and preventing needle-caused hemolysis. So this is coming, and please sign back up, tune back in, and follow the series through. There are things to learn that nursing school and any other allied health program did not teach the nurse, the paramedic, the medical assistant, the phlebotomist, the med tech. Anyone who's locating veins and accessing veins does not have this information. You do now.